Patients with IBS symptoms with urgency or incontinence and none of the medications are working, this is for you. You've tried everything for your IBS. You've tried the low FODMAP diet. You've tried elimination diets. You have tried over-the-counter medications. You've tried prescription medications. You've even kind of gone off the ranch or whatever it is, and you have done colonics, and you're doing all the things just because you want to have a bowel movement and you want to feel better. There are studies showing that up to 64% of patients with IBS also have fecal urgency. What is fecal urgency? That means that you get the urge to have a bowel movement, and if you are not like next to the toilet, something bad's going to happen. There are two studies, one out of the US and one out of Sweden, that demonstrate anywhere from 14 to 17% of patients with IBS also have fecal incontinence, which means that you actually do have bowel accidents. Okay, why is this relevant? The reason it's relevant is because patients with IBS are often treated with a variety of medications and lifestyle management. And for a percentage of patients, this works perfectly fine, and that's amazing. For another percentage of patients, this does not work fine, and that is not amazing. Enter sacral nerve stimulation. Sacral nerve stimulation is essentially like a pacemaker, and it helps with that gut-brain axis, right? There's some disconnect there that's happening in patients that have fecal incontinence and also in patients that have IBS. Now, the early data for SNS for the treatment of irritable bowel syndrome is still early. The results are actually very promising. And anecdotally, I have seen great results in some of my patients. This small 2019 randomized control trial showed that patients with IBS that had sacral nerve implantation demonstrated significant decrease in abdominal pain related to their IBS symptoms, as well as a notable reduction in bowel movements during the day. Now, this is for those patients that have IBS with diarrhea or mixed type. Now, the SNS data for fecal incontinence is there. The safety, the efficacy, greater than 90% of patients have reduced bowel accidents and have improvement in quality of life. And this is sustained in the long-term period. So those of you out there with IBS symptoms that also have urgency or incontinence, especially if you're having multiple bowel movements a day, SNS may be an appropriate therapy for you when everything else has failed. This is, for me, one of the most satisfying procedures to do because people with IBS are miserable. People with incontinence and urgency are miserable. You're always looking for the bathroom. And this is a very safe, effective, quick procedure to do with minimal downtime and very low risks. And it's got a great reward at the end when it does work. With urgency or incontinence and none of the medications are working, this is for you. You've tried everything for your IBS. You've tried the low FODMAP diet. You've tried elimination diets. You have tried over-the-counter medication.